Cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. It is primarily caused by persistent infection with certain types of human papillomavirus, HPV, a sexually transmitted infection. Here's an overview of the causes, symptoms, and prevention of cervical cancer. Causes. 1. Human papillomavirus, HPV, infection. Infection with certain high-risk types of HPV, particularly HPV 16 and HPV 18, is the primary cause of cervical cancer. 1. HPV is transmitted through sexual contact. 2. Weakened immune system. Factors that weaken the immune system, such as HIV infection or immunosuppressive medications, can increase the risk of HPV infection progressing to cervical cancer. 3. Other risk factors. Other risk factors for cervical cancer include smoking, early initiation of sexual activity, multiple sexual partners, a history of sexually transmitted infections, STIs, and a family history of cervical cancer. Symptoms. 1. Early stages of cervical cancer may not cause any noticeable symptoms. 1. As the cancer progresses, symptoms may include 2. Abnormal vaginal bleeding, such as bleeding between periods, after sex, or after menopause. 3. Pelvic pain or discomfort. 4. Pain during sexual intercourse. 5. Vaginal discharge that may be watery, bloody, or have a foul odor. 6. Urinary symptoms, such as frequent urination or blood in the urine. 7. Weight loss and fatigue in advanced stages of the disease. Prevention. 1. HPV vaccination. Vaccination against HPV can prevent infection with the most common high-risk types of HPV that cause cervical cancer. 1. The HPV vaccine is recommended for boys and girls around the ages of 11 or 12, although it can be given as early as age 9 and up to age 26 for females and age 21 for males. 2. Regular screening. Cervical cancer screening, including Pap smears and HPV testing, can detect precancerous changes or early-stage cancer when treatment is most effective. 2. Screening guidelines may vary depending on age and risk factors, but generally, regular screening should start around age 21 and continue as recommended by healthcare providers. 3. Safe sex practices. Practicing safe sex, including using condoms during sexual activity, can reduce the risk of HPV transmission. 4. Smoking cessation. Quitting smoking can lower the risk of cervical cancer, as smoking is associated with an increased risk of cervical cancer and other health problems. 5. Limiting sexual partners. Limiting the number of sexual partners and avoiding sexual contact with individuals who have multiple partners can reduce the risk of HPV infection. Overall, cervical cancer is primarily caused by HPV infection, but it can be prevented through vaccination, regular screening, practicing safe sex, quitting smoking, and other healthy lifestyle choices. Early detection and treatment are key to improving outcomes for individuals with cervical cancer.